Hello, welcome to Senior Connections. This is a program brought to you by Senior Resources, your local area agency on aging. We exist to serve seniors, primarily 60 years of age and older, and their families and caregivers, and we're happy to be with you today. Today I have three guests. From my right, retired Sheriff Bob Carter. I'm going to say retired three times. Retired Muskegon Chronicle publisher Gary Ostrom, and Nancy McCarthy, who is retired Executive Director of VNS in Hospice, and I can never remember which is the official name you were under, but formerly known as Hackley Visiting Nurses. And so today we are going to talk about something exciting in the community. There is a proposed senior millage on the August 2nd ballot, and these three fine people are members of the Muskegon County Senior Wellness Committee. And so we're going to inform you a little bit about what's going on with this upcoming ballot proposal and try to give you some information so you can be an educated voter. So welcome. Happy to have you all here.
Thank you.
So let's talk a little bit about the senior millage and how it came about. Public Act 39 allows for a senior millage. It allows for county commissioners to approve that up to 1 mil. And as you all know, our county commission voted for that in March to put that on the August 2nd ballot. By Public Act 39, the services that could be provided for in a senior millage are for people 60 and older. So Gary, why don't you talk to us a little bit about what the question is, what we think the cost will be for homeowners.
Well, the great thing about the senior millage that's coming up is that we are one of the few remaining counties in Michigan that doesn't have a senior millage. I'm not sure why we've been behind the curve on this, because it makes so much sense. The senior citizens are, of course, the fastest growing segment in our population, and they're going to continue to grow percentage-wise. And in order to provide services that'll keep seniors in their homes and out of nursing homes, it's really a relatively inexpensive thing to do. On August 2nd, we'll all have a chance to go to the polls and decide whether we want the senior millage. And as a senior citizen, I want it. But it's a half a mil, so it's only half of what is possible to be claimed under the Public Act. And what people really want to know, I guess, is what'll it cost me? And if you have a house of $100,000 value, it would be about $25 a year, which I think is a real bargain for the things that it can provide. Absolutely.
So the millage is for 8 years. It would start being collected this December, go out for 8 years, and as you said, $25 a year for a $100,000 home, which is the average value of a home in Muskegon County. Certainly there are many above, there are many below, that's what an average is. But it's I think fairly reasonable. It comes down to 6 cents a day. So you're talking about, you know, $225 a month or something. So you're giving up a cup of coffee. A lot of places, not even a cup of coffee, a couple candy bars or something. So it's a health initiative as well. Because
but the thing is that for that small amount, we could help senior citizens stay where they want to live, stay in their own home, stay in their apartment, to remain independent.
Absolutely.
And we're saving the community hundreds of thousands of dollars by preventing or slowing down the need to move into various kinds of assisted living or nursing homes. It's a bargain for everybody.
It is. And I think the committee has figured, based on estimated property values now, that half mil will bring in about $2.1 million a year. And that's local money then that there's some control over. It's not relying on the state and federal money that comes in. So you're right, I think most people would see that as a bargain. So Nancy, let's talk about what are some of the things the millage could fund. We don't know all of that for sure,
right,
of course,
but certainly we know, as Gary said, seniors are, you know, living longer. There's many more of us going forward, and we want to make sure that people stay as healthy as they can. And so we envision programs that will address like exercise plans, nutrition classes, things that will help people to stay well, first of all, and so that they don't need extra help. But when they do, we think that, you know, that some of the in-home services that where gaps exist. I mean, a lot of people think that Medicare, Medicaid cover just about anything you might need at home, but that really isn't true. You really have to qualify with a physical kind of disability and so forth, and it's temporary. And so it was never meant to be an ongoing solution to people's needs at home. But certainly, as having been the director of a home care agency for many, many years, it was always surprising just a little bit of service could actually, you know, keep somebody home, like twice a week. Somebody going in just to maybe do some shopping, grocery shopping, or prepare a simple meal, do some laundry because folks can't get to the basement anymore where their washing machine is located. Someone might need help with assistance with bathing. And the great thing is somebody's going to those homes too. So a couple times a week, somebody's checking in.
Checking on them.
And making sure that they don't need further services.
Absolutely.
The other thing is that many people don't know how to access the services. And so, you know, we see like some sort of advocacy out there where just helping people line up the services that are already available. We don't anticipate the millage money, you know, being like the first money spent. We will certainly use all resources out there first, and this will be kind of a fee source of last resort, so to speak. But certainly should allow us to do a lot more things.
I know that one of our committee members has said there are a lot of, as you said, there are funding sources available to many people. But sometimes it takes, we all know, it takes a while to get through that red tape. So for example, if there's a veteran and they qualify for veterans assistance, then certainly that's what we'll be doing first. But in the meantime, while it takes some time, or getting disability or something, there is a gap in service, and millage money might be able to fill that gap and help somebody out temporarily. Or Bob, knowing your work with United Way and all the focus on asset limited income constrained employed, we know there are a lot of people who fall in between that, yes, I can easily pay for anything I need because I was fortunate in life and I worked hard and I saved, and that group that qualifies for the services, there's a lot of people in between there that are going to need some assistance. They can pay for some of it, but maybe not all of it. So talk to us, Bob, a little bit about what was your reason for deciding to get involved with the Senior Wellness Committee in this
Well, to be honest, it's hard to say no when people talk to you about an effort to provide a better quality of life for those folks in our community. And I think seniors are right at the top of that list of need, especially in this village where you have to be 60 years of age or older. You're talking about people who are getting close to us. I think with the population estimates in the next 20 years, we're talking about doubling our population. So the need for what Nancy talked about in the community is really going to need the effort, and I think this millage will allow us that opportunity to do that.
Absolutely. So you bring up a great point. We've talked about, and I don't know that a lot of people know this term, but we've talked about it a lot in our committee, the senior tsunami, which gives me a great visual. But it really is so accurate because we've got in Muskegon County around 36,000 seniors currently. In the next 5 years alone, we're supposed to have over a 35% increase in that. In the next roughly 20 years, we think that population is going to double. So Nancy, talk to us a little bit about that. Again, I think from your perspective as having worked for a home care agency, where not all of your clientele were seniors, but a lot of it was. And you're very involved in Age Well on their board and lots of things. Talk to us a little bit about those needs a little bit more, and you know, how we prepare for that silver tsunami.
Right. Again, I think, you know, we're all living longer than any of our predecessors did. And so we need to be, you know, be able to be prepared to do that. And we want to be, of course, as healthy as we can. One of the important things, too, that for people to know is that we want to be able to bring services to the outer reaches of the county. You know, we don't want it just focused in Norton Shores where the building lays, but we'd like to be able to bring services to the Whitehall Montagues, to the Ravennas and Fruitports and Muskegon Heights and so forth. So we envision some of this millage money being used for that purpose, to take these things on the road to senior centers, to libraries, to places where seniors can easily get to. Another issue is transportation. You know, once you can't drive anymore for whatever reason, visual or physical impairment, so forth and so on, it's hard to get around, and we don't have transportation. I mean, we do have some things, the GO bus, that you do have to make an appointment and have some advance notice for all those kinds of things, and so it's harder for people to get to things, I think. So transportation is an area that certainly could be beefed up. You know, Meals on Wheels, right now they have a waiting list of people waiting for meals. I don't think anybody should have to wait for a meal. So again, monies could help that, you know, that population if there are people waiting for meals that aren't being currently served. That's another option. And of course the in-home services, as we talked about a little bit before.
And I think one of the things that I've heard talked about is in Senior Resources, we do funding for a lot of in-home services, and especially for people in the My Choice Waiver program that are lower income and qualify for that. But sometimes you can, due to somebody's financial situation, you might get somebody in to give them a bath once a week. Well, do any of you want to take a bath just once a week? No. I mean, there's dignity and there's health involved in all of that. And the Meals on Wheels, you know, not only are you bringing a nutritious meal to people to make sure that they can eat, but it's that safety check that's oh so important. And you can, as you said, you can have somebody stay in their home, which is what over 90% of people prefer. That there are some people who don't want to be a burden or whatever, but most people want to stay at home as long as they can. And to have services that may cost $5,000, $6,000 a year to get just that little bit of help versus the cost of a nursing home, $70,000, $80,000, $90,000 or more $1,000 a year, is a huge, huge savings to the individuals and to the community who are relying on services. And the facts are that, you know, when a lot of these, you know, Medicare and Medicaid and all these programs were set up, as you said, they were temporary. We weren't living into our 80s, but the fastest growing segment of the aging population is the people who are 85 and older. And just today I got an email at work from somebody who said, I need some help. My dad is 92 and the neighbors don't want him driving anymore. It's worrying them. So they were asking, number one, is there a place that they can get tested? And yes, there are. And we've had those people on our show before. But also, are there services for transportation so he can get to the store, so he can get out once in a while? And of course, I sent that on to our options counselors, but I'm thinking not nearly enough of that is available. Right. Because again, we can find medical transportation usually to get somebody to dialysis or things like the doctor's appointments, unless we're going out of county, which is a whole other issue. But the socialization is so important to keeping people in their homes.
And our committee members have discussed that. I mean, Sharon has always said that that's the one thing that really helped her through the whole process.
Right.
So it's...
And I think, you know, as Gary said, it's us taking care of our community. It's community money now. You know, we're not dependent on the government in any sense of the word. So these monies that will be collected with the millage are really local monies that will stay in our community and be providing services. You know, we don't intend for any bricks and mortar. There will be no new centers built and so forth and so on with the money. We really intend for it to all go to services. And
partner with others in the community, whether it's the library, which also has a millage in August, and we've talked about using their facilities for some of these programs, or the schools or churches or VFWs that are out in the community. And as you said, really important to note, all around the community. It's not just, the center of the universe isn't Tanglewood Park. It's important that we get out everywhere, and that we don't yet know what those programs will be. We have some ideas, transportation, probably the meals program certainly, but there are so many possibilities for new innovative things, some educational programs coming in about health, or just bringing in speakers. And for people of all walks of life, it's not, this millage isn't just for poor older people, it's for all people. And for the people who are under 60. So, you know, we know that voters, really regular voters, are older citizens, but certainly there are lots of us, and I'm one who's still under 60, Bob, talk to us. Yeah. Why do you look shocked by that, Bob? I'm crushed. Wow.
Well, I didn't think it would even occur to us.
Okay. That wasn't anywhere near that.
Right.
I'm at the end of that baby boomer generation. I'm like the second to the last year of that. And I'm concerned about it, not just because of my work. I think it's really important. My in-laws certainly qualify, and they're here local.
Well, if I can chime in for just a minute, you know, I think we're pretty certain that most of the senior citizens who vote, and that's a lot of them, are going to see the value of this, and they're going to go to the polls and they're going to support it. But what about those who are like Lisa?
That's what I was just going to ask.
We're very young and vivacious.
Sandwich generation.
That's right.
Yeah, right.
It's really almost as important for those who are turning into caregivers. My mother lived to be 90, and she was living in an apartment a block from our house for about a dozen years, and we were there twice a day, every single day, 7 days a week. And it was a labor of love. We didn't mind, but we also had vacations and we had other things to do. And how wonderful it would have been had there been some respite care at that time. Going away was a major, major issue for us. This would have made a world of difference. And she wound up in a nursing home the last few years, and I felt sorry for her because that's not where she wanted to be. Finally, there was no other choice. But she was able to stay on in her own place for several years longer because she had people coming in and taking care of the daily necessities. And that's one of the things that this millage is going to help those who are the caregivers, who are taking care of parents and other relatives.
Well, and I know we've had those conversations, Bob, in our committee meetings, that because a lot of our committee members are over 60, and I know a lot of you have had conversations. Some of you have kids, you have family who lives here locally, and I know you're very active with your, kids and grandkids activities. But we've also had lots of discussions about people who don't want to be a burden on their kids, because that sandwich generation, as you said, the people who are still raising their families, and then they've got older parents that they need to worry about. Talk to us a little bit about that. Have you ever had any of those conversations with your kids, or?
Yeah,
you're way too young.
Well, sometimes they don't like to talk about it either, but I think Gary brings up a very good point. I mean, the people in our community who really seriously need to support this issue are exactly those folks, like me, or like somebody that's got a grandparent or a child or something that's going to need help. It's just the way of life. And if you want your loved ones to have a good quality of life, then this is a very important step in the future years. You at 60, say you were 60, you're looking at the possibility of having to provide some of these services, and you really want to be able to have the best ones available for your loved ones, that's for sure. As well as we want everybody to have that same outlook. Well,
and I think we've said in meetings, if we have a great quality of life for our seniors, we've got a great quality of life for everybody in the community. We really, I think if you look at that, I mean, we know how important education is and that there's great support for education in Muskegon County, and so we're lucky that way. But I don't think you always think about what you're going to need later, because that just seems so far down the road. And I always laugh at my daughter, who's 15, who thinks of, when I was her age, I thought 60 was old. Her mom didn't have her to, but she always says, you're not old till you're 80. Well, as my mother gets closer to that age inches up for Hannah, because she doesn't think of her grandma as old, and grandma's only a few years younger than that. And so it's just interesting how that perspective changes the older you get, of course. But the caregiving support and knowing, as Gary said, how that can make a difference in letting somebody stay where they'd like to. And you're right, though, about your kids. People don't want to have that conversation because you don't like to think of your parents or your aunt or your uncle dying and that they're going to need some help. Do you think they're superhuman? I think my mom's going to, just be able to drive herself to Florida every year for as long as she wants. At some point, I won't want her to do that. I don't really want her to now, but But to know that there are services available to help her stay
Exactly.
is just so vital.
And from a personal standpoint, now Nancy and Bob and I, we're all retired. We've already crossed that threshold, and we're all doing great. You know, we take care of ourselves, and everything is going along as good as can possibly go. But we all have seen relatives, and we've had friends for sure, who all of a sudden, health, family situation can turn on a dime. And it's easy to say, well, I don't need that. But you have to add, I don't need that right this minute.
Exactly.
We don't know what the future is going to hold,
None of
and
us
everybody needs to be concerned about the services that can be provided.
Absolutely.
Well, it's almost a form of insurance. I mean, we have insurance for our car, for our health, for life insurance, because we hope we don't ever need it, but just in case we want to make sure. It's the same thing, really. It's kind of a senior insurance to make sure, because we all know government funding rises and falls, and services go depending on the whim of the Congress and what the economic state is. And this could vary a little bit, because this will go on housing values, certainly. But to have that local money coming in, the local control, and having local citizens decide where that money is going
And
to
that's
go.
exactly why most of the counties in Michigan have already done
71
a
of
senior
them.
millage.
71 out of
counties.
83. And every
Yes.
one of them has passed it on the first attempt as well. And it's important to all of them. And we are surrounded by counties. I mean,
Right.
to the north, Oceana has it. Newaygo has it. Kent has it. In northern Ottawa, not all of county, but northern Ottawa County has it. And
Right.
you know, if you were to look at a map, there's like 2 counties in the UP. There's a few in the Lansing and Detroit area, but almost everybody in Kalamazoo. I think Kalamazoo and Muskegon are the only counties in West Michigan that don't have a senior millage.
And I think Muskegon County people are frugal. They've been very careful. That's probably why we've held out as long as we have. But there's no reason not to do something as inexpensive as this.
And not when we know that the numbers are going to increase. And we want to keep this an important and, you know, vital, livable community. One of our committee members, Caroline, talks about how she moved here years ago. She chose to come here from Dayton when she retired because, you know, our beautiful lake, of course. It's a fabulous community. That's why we all live here. We love it, and we want to make sure that we can stay here. We know that the winters are tough, and some people are going to go south for a little bit, but we want them coming back, and we don't want them to choose to go to another community in the state because they've got services that we don't have here. So it is an economic development issue as well, because also the money that goes out for services, those are jobs. People who are coming into your home, and the healthcare business is one of the fastest growing professions there is across the country, and it's going to get more so because of that silver tsunami coming. More and more healthcare workers are going to be needed to provide those services. And we want to make sure those are there. So Nancy, tell us a little bit about what your personal reasons are for being involved in this.
Well, you know, as I say, I've worked with seniors for most of my career as a nurse, and so, you know, I have a great affinity for them, and now, of course, myself being a senior, it just makes good sense. I mean, it's called being prepared, you know, being prepared for the future. And so, as Gary said, we are all pretty healthy right now, but you know, you don't know when that day is going to come, and so we just want to be sure that there are services out there when we do need them. We want services to be there for all of the other folks in our community who already need them, and so it just makes good sense.
I think the other part of that is what Gary said. You got 71 counties in the state of Michigan.
I
who have
know.
it, and we don't have it.
It's terrible.
It seems like
We don't want to be
as
the
an
first one to
important-
go down either.
Yeah, right.
We don't
No,
need that distinction.
we are not going to-
We're not looking for that one.
But the topic of seniors in this community with the passage of this millage would put us equal with everybody else. And I think that's kind of where we really want to go. We want to be able to say we provide for our senior citizens to the best of our ability. We can't say that now because we know a lot of these facts, and we know that there's shortcomings, and this is a methodology for us to shore that up.
It seems so easy when you know that just getting somebody in the house to help a couple times a week can make that difference. Just making sure somebody has a ride to where they need to go, and it's so cheap. It's so reasonable. I mean, it may seem like a couple of hours, 3-4 hours of help a week won't make a difference, but it truly does. We hear
Well,
about
sure
it
it does.
all the time from people. And I know I'm right now without my washing machine, and it's just driving me crazy to not be able to do that as I'm used to doing it. It makes me think, though, I had to go to my mother-in-law's to do laundry last weekend, and if we don't get that fixed in the next couple of days, I'm going to be looking at it, and it made me think about
Doing it
people who
again.
go to the laundromat. And then how do I carry all that? And I'm able-bodied, and I have teenagers who could help me with that. But if I'm a senior and I have that issue, or going down in the basement isn't safe, and it's not cost-effective to move the washer and dryer up, and that's the only issue I have, that's not enough reason to have to move out of your home, because sometimes you just can't afford those. Before we run out of time, I want to make sure that we let people know this is not the only committee. I'm going to quickly mention other names of people who are on this very, very active committee that's been meeting for a year or more. Gloria Gardner, Sharon Ackerman, Chris Colley, Pam Curtis, Sean Lazarot, Kathy Moore, Janet Burrow, Caroline Shercliffe, Diane Smith, and Heather Smith that make up our fabulous committee. And we want to go out among the community. We're happy to be talking about it here. We've talked about it a long time in our committee members. We've started getting out to meetings. But if you have a group that would like to hear more about this, call us at Senior Resources. You can call me directly, and I can get one of these fine folks to come out and speak. My number is 231-733-3509. That takes you right to me, and I'm happy to try to line up some speakers. We can send out information, and we've got a website for this as well. www.MuskegonCountySeniorMillage.com, or you can just Google that. It's exactly what we say it is, Muskegon County Senior Millage. And there's a Facebook page. If you're inclined on the social media, you can look up Muskegon County Senior Millage. And there's some more information up there. And so we just want to make sure that you've got those couple of sites. But we'd love to get out and talk more. As you can tell, we're a passionate group. We have plenty to say, but we can shorten it to a 5-10 minute conversation if need be. But it's really important to us, I think, that we just get the word out. Because I do think that most people who've heard about this are in favor of it, regardless of their age. Most people think that by the time you get to 60 and above and you've been working or raising your family, you deserve to have a little bit of help if needed to stay healthy,
Correct.
to stay in your home. The comments I've heard from people are, well, this is a no-brainer. Why wouldn't we do this?
Then August 2nd will be here before we know it. I don't want to wish summer away.
No,
but
because we haven't really started it yet. But yes, so August 2nd. And then for people who vote absentee ballots, those come out usually in mid-June. Hopefully you'll be hearing some more information by that time. But we really want people to talk about it, to feel free to ask questions, to spread the word to their friends. What else do we need to add?
I think that we always need to keep in mind, more than anything, the senior citizens who will benefit from this.
Correct.
This is really what it's about. It's helping people, and that's what community is. It's helping others. It's supporting each other.
Absolutely. Bob, anything to add?
No, I think it's been articulated very well.
Nancy?
No, just get out and vote on August 2nd.
Yeah.
That's really all we can ask. So August 2nd is the vote if you're a Muskegon County resident. If you vote absentee, please make sure you remember to vote before that. There are other important issues on the ballot as well. So I want to thank my guests, Bob, Gary, Nancy. Really appreciate you taking the time to come out and let our viewers know what's going on with the senior millage on the August 2nd ballot in Muskegon County. So remember, if you have any questions about this or anything else senior related, you can always call Senior Resources. If you can't remember that, you can call 211, those 3 numbers, and they can get you to us. We'll make sure that they know about the senior millage. So if you can't remember to call us at Senior Resources or look up our website, call 211. I want to thank you 3 for your time. And remember, if you live in Muskegon County, please vote August 2nd. Thank you.